Hello everyone, welcome to Unacademy special classes, and this is in regards to in-depth analysis of editorials and articles for prelims 2020. And about me, I'm Sandeep Bhushan Thummala, and my credentials are: I have 8 years of teaching experience for civil services. I teach international relations, internal security, and in-depth analysis of editorials and articles. And this special class is in regards to how to crack prelim 2020, and then how the analysis of the editorials, articles, and the contemporary issues of the newspaper will be important, and even all the contemporary issues will be useful for the prelims 2020 and also for the mains 2020. So here in this session, that is in the special class, definitely you would be getting the maximum privilege of how you need to go ahead with identifying the keywords, and then how best you can try to identify the factual and also analytical point of view questions, key phrases, or the keywords which are important for the prelims 2020 and also mains 2020. That is, you will be having a thorough understanding and a better understanding in regards to the how best you can be well prepared for the prelims and also for the mains point of view, that is descriptive also. Before I get into the topic, I would say a very big hi to everyone who have joined. That is Lavi Verma and Wag have joined. Hi to both of you. Tanvi Kashyap has also joined. Tanvi Kashyap, good morning to you. Sampa Bhaumika has also joined. Good morning, Sampa. And then today we will take up a trending topic which is very very important, and which is a topic which many of the civil servant aspirant might have missed it, but you have the opportunity that you are well aware that, or else you are in the proper track, you are on the proper platform, that this is important for the prelims and also for the mains point of view. So definitely I would be here once again that my sessions or the special class will be definitely useful for you in regards to the prelims and also mains point of view. So I have taken the trending topic. It is in regards to the COVID-19 outbreak and people with disabilities. Please do understand this, because we have seen many. The news in the newspaper or elsewhere. We have seen it is in regards to the COVID-19 pandemic and its impact on various. We have looked at economy, Indian economy, and then migrant workers, in regards to the manufacturing sectors or the core sectors, or else in regards to the political system in the world, and then in regards to the social behavior. But definitely there was a point wherein many of them, or else in regards to the civil servant aspirants, I'm saying might have missed the COVID-19 outbreak from the, what is a concept. What we need to look at is in regards to the people with disabilities. So Kumar Sarva has joined, Harpreet Singh has joined. Everyone, very good morning, and hi to Harpreet also. Very good morning. And the one who are also in the YouTube, a very good morning to everyone. The one. So now we would focus on the people with disabilities, because we have been discussing almost what do you say 3 weeks, almost 3 weeks, that COVID-19 and its impact on, especially onto the, what do you say, people who have lost jobs, or who are having all the faculties. That is, they are not by any means that they are not having any kind of disabilities. But we will definitely focus on today's topic, that is a trending topic in regards to the COVID-19 outbreak with people with disabilities. This is very very important for prelims and also for the mains point of view. And when you look at this photograph, it knows, you can make it very clear, that is, what is the coronavirus, the SARS-CoV-2 or the virus, which it is not just impacting the, what do you say, if you look at the photograph, it is that the people with the disabled are being hit. No, what it is the impact of this disabled people in all sphere. Yes, in all sphere. That is what I'll take up. We have 1 hour time, Harvit. Definitely in regards to the all spheres, how they have been affected, I will go through it. That is why I'm saying this is a trending topic that many of you, the civil servant aspirant, might have missed this. It might have slipped from your mind that we did not, there was no possibility that that linking of COVID-19 outbreak with the people with disabilities. But we will focus on that, and it is very, very important in regards to the prelims and also mains point of view. Vikram Kumar, Divya Dama, everyone who have joined, a very good morning to you all. Kiran Noah, John Chota Bhim has also joined. Very good morning. And then this figure very clearly says that the coronavirus has not left anyone across the globe, and it has affected or infected everyone because it doesn't know which race, which religion, which country, no boundaries for coronavirus. So it has spread across all the countries across the globe, and then it has impacted everyone. Now we will look at the way coronavirus has impacted everyone, and then focusing with how the impact would be onto the people with disabilities, and what because of the outbreak, what is the responsibility, and what is the responsibility of the individuals, and also that how the people with disabilities have to be protected or how they are being affected, and what is that they are tend to be affected more comparatively with the normal people, because the social distancing has gone ahead. The government has taken up 3 weeks time in regards to the national lockdown or else social distancing, and then our Prime Minister Narendra Modi has also extended it further to May first week, mid of the first week. So it is all very clear that social distancing means we have to be apart. But if all the faculties, that means if we are healthy, then definitely we'll be separate, we'll be maintaining social distancing, and we'll try to make sure that we try to again learn to ourselves. But here when you're looking at the point, it is that the social distancing, when it is maintained for the people with disabilities, are the one, actually it is the disabled people. When you are talking about people with disabilities, they are disabled people. That means they are dependent on others. Please do understand this. They are dependent on others. When we are talking about they are dependent on others, that means definitely the social distancing, then there is a worry in regards to the social distancing. So how, I mean, an individual human being who is, what do you say, with best faculties or healthy, wouldn't maintain or would maintain the social distancing, not touching or not helping or not giving care to the people with disabilities. That is a concern, and that all those we will look at how best we can, what do you say, the government of India can help it, and what are the problems or the challenges or the unique challenges the people with disabilities actually face, and that we will look at now. And Harpreet Singh says that 2.21 percentage of people in Indian population is disabled, so that is big number. Yes, 2.68 crore according to the census of 2001. Okay, fine. Chota Bhim says that Ambedkar birthday. Okay, fine, very good. April 14 is Ambedkar Jayanti. Thank you very much. And then Nikila also has joined. So good morning to Nikila, you also. And then we will discuss about today's topic is in regards to the COVID-19, outbreak of COVID-19 and people with disabilities Now, COVID-19 outbreak and people with disabilities is a topic what I have taken, and this is in regards to how we can make sure that it will be best suitable for the prelims and mains point of view. Butterfly has joined, Shushma Reddy has, Joshi has joined, and then Tamuk has joined. Everyone, a very big Y once again. A very big hi to everyone. And then we have seen that the WHO has, in the mid of March 2020, it has declared, or it has declared that the COVID-19 as a pandemic. COVID-19 as a pandemic, as we are all aware that it was in the mid-March 2020, WHO has gone ahead with making an announcement that the outbreak of the COVID-19 is a pandemic, because the speed and the scale at which the transmission is going on, or the spread of the virus is going on, is very violent. So that is why it was very difficult to contain the virus. The spread of the virus or the transmission of the virus was very difficult to contain it. That is why the WHO in the mid March 2020 has come up with a statement that it is a pandemic. So we know that WHO has declared COVID-19 as a pandemic. And now what is important is, when it is declaring the COVID-19 as a pandemic, that means WHO and along with the other health authorities are definitely in the picture, in the race, that they are going ahead with taking action. What action? Action definitely to contain the COVID-19 outbreak. So when it is pandemic, it is the responsibility of WHO, it is responsibility of the public health authorities internationally and nationally also, and then the respective governments and then the citizens also have the responsibility to contain the spread of virus. That is why the national lockdown has taken place. That is why the social distancing has come into existence, wherein the social distancing is a norm, is a stricter measure wherein we can try to make sure that the infection doesn't take place at a wider length and breadth, so that we can try to contain the spread of virus. But there is a problem because of the social distancing, because of the national distancing. Yes, definitely it is for the public health, it is for the everyone across the what do you say the humankind across the globe. But definitely there are certain population, that is few of them, who are disabled, and wherein when we are talking about national lockdown, when we are talking about a stricter measure, we are talking about health hygiene, washing hands, and then making sure that we maintain social distancing, and then we have to what you say maintain that almost when sneezing or coughing somewhere around 3 to 6 feet distancing. Yes, those are all right, those are all correct, those are all stricter measure, but there are certain populations wherein this all these measures would be impacting significantly because of this what is a COVID-19 on certain population, and those populations are the disabled people. Those persons are the persons with disabled. And Chotabim says that appropriate actions are yes, and it is appropriate action, no doubt. But we need to, I mean, the focus what we are going ahead today is that we are not even what do you say keeping aside the persons with disabled, not everyone person, but there are certain population of the entire the 1.3 billion population of the India, wherein we have to focus on even that certain population, wherein those populations are constituting or they constitute the persons with disabled. So we are worried about it, and there is necessity that the government has to be worried about it, because the government has come up with a bill. I will talk about the bill and also act which talks about the persons with disabilities. Persons with disabilities, it is in regards to the international, or that is in regards to the United Nations itself. So definitely there is a concern that we have to look at it, and it is a need of the hour that we need to focus as a civil, I mean you all as a civil servant aspirant from prelims and also from the mains point of view. And a very big hi to everyone who has joined. And Arpit says the blind people generally feel their environment by touching. Yes, because of COVID-19. Yes, exactly. That is what I would say now. That is what I would say. My entire discussion would be on the importance of the people with disabilities, how the social distancing has to be taken into consideration, and how we as a citizens, individuals, feel responsible that we need to also protect not only the spread of not only making sure that the spread of virus doesn't take place by being part of the social distancing, but at the same time we have to protect being part of a good human being, being part of the inclusive society. Please do understand, being part of the inclusive society, being part of the good human being, that we need to be actually supporting by whatever means we can go ahead to the people with disabilities, not only at the time of what is a normal times, but even at the time of COVID-19. This is essential, this is very crucial for the people, especially in regards to the PWD, that is people with disability. And actions need to be taken to ensure that people with disability, this is very important. Actions, when we are talking about, it is not only the action in regards to the individuals, that is the citizens, or the actions only from the public or the actions from the government. It is all that actions, it should be in regards to the healthcare services, in regards to the water and sanitation services, in regards to the public health. And public health, when we are talking about, it is in regards to the public health information, that is what the persons with disabilities at this moment, that is because of the outbreak of the COVID-19, what is important or what are the actions we need to do individually and then the government, is that the people with disabilities are ensured, or they are supposed to get the information of entire what is happening in regards to the COVID-19, the spread of virus, the infection, or else the kind of measures to be taken. And not only that, they should also have the access to the healthcare services. That is important. Access to the healthcare services and access to the water and sanitation, because this is what is important, because the entire government or else the measures are in regards to the washing hand frequently. So how best we can try to provide water and sanitation services and also healthcare services accompanied with the public health information is very important to the people with disabilities. So that is what the need of the hour for the government, for the public, and for each and every responsible citizen. by our means that we need to go ahead with providing, we need to go ahead with providing the information to the people with disabilities. Chotabim says that they depend upon others. Now no one come to help. That is what the concern is. I was talking about the unique challenges. I will also discuss all those challenges. The unique challenges what the people with disabilities are experiencing and would experience because of the COVID-19 for some more time. It could be 3 to 6 months down the line. That is what I was talking about couple of weeks, a couple of days back in one of the special class session. I was talking about the social behavior, social prejudice. I was talking about social harmony. I was talking about all this is part of this also. And then Harpreet says, because of lockdown and coronavirus, common citizens avoid most people. Now government and health services and police services need to render the services to the disabled people. Yes, very good, very well said. And I to everyone who have joined now. And what is important is not only the government, not only the health services, frontline workers, not only police, but we all, at least by whatever means we can. There are different measures. I will definitely explain all those, and then you can understand that how can we as an individual can also be part of the system wherein even the people with disabilities are not left or not cornered or not isolated at the time of COVID-19 outbreak. So that is what is important for the civil servant aspirants in regards to prelims and in regards to mains. And people with disabilities need support than any other at this moment, because they are the one who are the worst hit more than the migrants. We were talking about the worst hit in regards to the national lockdown. I was talking about the worst hit because of the mm, social distancing I was talking about. So that they were migrant workers I was talking about, the informal sectors, people who are working or daily laborers. More than that, the one which is not seen, the one which is not actually what you say taken into consideration, the more the, I'm sorry I'm saying this, but it is not highlighted by anyone in regards to the people with disabilities. Migrant workers, economy, health, everything has been highlighted, but the people with disabilities are not highlighted. That is what I was repeatedly saying throughout my lectures. UPSC will focus on the one wherein you are not focusing. UPSC will definitely identify those areas wherein you might miss or you might skip those areas. So that is why the one I've taken today is in regards to the trending topic, that is COVID-19 outbreak and then people with disabilities. And now at this junction, because of the outbreak, the people with disabilities are the one who needs more support from the society. Please do understand. I'm not just saying from the government, from the society. Please do understand my word, keyword, from the society, from the society. So that is very important. And now I'll go to the next point. I would say hi to everyone. Okay, Tejaswar Lucky has also joined, Chotabhima has joined, and again everyone has joined. Viresh, PVG, Dileshwar, Sandra, Elisa, Rahul, Nishant, everyone, everyone. A hi, big hi to everyone. And then Tejaswar is saying, sir, your number please. Okay, I will give the, I've just confirmed with the team, I mean Unacademy team, and then it is my number in regards to the WhatsApp group. WhatsApp group is this one. Good morning to Anuj, good morning to Lavanya, and then WhatsApp group is 9292000311. So now we will get into the next point, that is in regards to the, when we look at again in kind of information, that is the statistics or the facts in regards to the total global population. If you look at, you have 15% of the total global population, that is over a billion. That means who are within or who are part of the disabled, who are part of the disability are 15% of the global population. That is, it's around 1 billion who are disabled, and of whom 2 to 4 percentage experience significant difficulties in functioning. That means they are totally dependent on others. That means they are totally dependent on others. That is the entire, out of the 15% of the total global population who are, what do you say, disabled. The entire global population with disability is 15 percentage, and out of the 15 percentage, 2.4 percentage experience a very significant difficulty in regards to functioning their own functions or taking care of themselves. So that is what is the crisis, wherein the crisis in regards to the people with disabilities are facing. in general I'm talking about. And again, now because of the social distancing of the COVID-19, that is pandemic, now look at the situation, we can sense it, we can at least think about it, what could be the situation, or how the people, or how the society looks at now with the to the people with disabilities. Because first of all itself, people with disabilities are not agreed or not accepted in toto I'm saying in toto in the society. But now at this situation, look at what kind of trauma they might be facing, what kind of agony they might have facing, because there is no one now they would come, because of the social distancing, because of maintaining the physical distancing. That is what is important, that if you look at the statistic, that is 15% of the global population constitutes the disabilities, and then out of the 15 percentage, it is 2.5 2.4 2 to 4 percentage, which is again part of the, but they are unable to function themselves, they are totally dependent on others. It could be the family members, or it could be the caregivers in the sense, the one who is who would be helping, a helper who would be paid. So this is again in regards to the prelims point of view, please take a note of this. And many of these people, I mean the one who are disabled, require assistive technologies. This is very important. So at this moment, what we can do, I mean what individuals or what different people can go ahead doing is that, or different organizations, business activities can go ahead, or else few startup companies can also go ahead with doing that, along with the public and private sectors, public government, that is public, that is the government, and the private sectors, and also startups can go ahead trying to help out, or else try to reach the people with disabilities. Because at the process of the COVID-19, or the outbreak of the COVID-19 pandemic, that is, there could be an assistive in regards to the technologies, so that can be provided by the startups, by the private companies, as a social, as a corporate social responsibilities. Please do understand the words I'm using is keywords, as a corporate social responsibility, and also as a responsibility of individual, that is as a citizen. They require low vision devices that can be provided, they require wheelchairs that can be provided, and they require even hearing aids, even that can be provided. And this number is expected to double, that what we are talking about now. The population of the disabled across the globe is a billion, and that would cross about 2 billion by the year 2050. So this is very clear that the persons with disabilities will definitely increase because of various reasons. We'll not get into it. It could be scientific, it would be ecology and environment. Because of various reasons, that persons with disabilities who are born with persons with disabilities, and later on also persons with disabilities in the due course of their life, would also increase from 1 billion now what it is count to 2 billion by 2015. So therein it is necessary that we need to have, or we need to provide them the assistive technologies. That is, what kind of technologies? That is low vision devices for the one who are eyesight problem, and then the wheelchairs who cannot walk, or the hearing aids for the one who are unable to listen. So this is what it is. And when we compare this, we have to spoken about in regards to the world global, and now we will talk about or look into the India, the country, and the one who have all joined. I would say a big hi to everyone today. A big hi to everyone. Lakshmi Narayana, Kushbu, Archana, Rajini, Priya, Amin, Deepu, everyone, a big hi to everyone. And now I move to the what you said, the process in regards to the India, in regards to the PW, that is persons with disabilities. India has a home for almost 150 million people. In India are the persons with disabilities, and that is very, I mean a very good amount. That is, it is a cause of concern, that is a high degree of disability what we have in regards to the 150 million people from the 1.3 billion people. So nearly 25 to 30 million have severe disability. The way we were talking about, 15% of the global population constitutes the disabilities, and out of that 2 to 4 percentage are the one who have the severe disability, and then they are all dependent on the family members or the caregivers or the taker. And in regards to India, it is 150 million people who are part of the persons with disabilities, and then from the 150 million, it is around 25 to 30 million people are very severely disabled, and wherein they are totally dependent on their family members or to the caregivers. So if you look at this photograph, I have kept this because it is the responsibility as a family member. Also, we should feel responsibility that we need to protect the one whoever is disabled, not only in regards to. But why I'm saying why I put this is because everything starts from home. Even the kind of help also start from home. So we need to go ahead with that. We also care the disabled people who are in this picture in regards to the senior citizens. Not only that, whoever are in regards to the disabled, we have to take care of them whatever means we can. And that kind of help starts from our home, and it will spread across the society, and that is what the society has to actually think about the peoples with disabilities due to the COVID-19 outbreak. And we will look at the unique challenges what the people with disabilities are actually facing or would face generally, and also how it impacts a lot at the time of the pandemic situation or else the outbreak of COVID-19. Generally, they may not be eating properly because they are disabled. Even to eat, it is very difficult for them because the faculties, that is the different the parts, are not the same as a normal or a healthy human being. So they cannot eat properly and may experience higher stress. And because at this moment, because of the COVID-19, there is definitely a sense of, even we feel definitely when we are watching the news, when it is spreading so violent and it is crossing, what do you say, every day somewhere around 1,000 infection people, I mean infected patients are increasing. So when we only look at the news, then definitely a kind of stress and agony is definitely onto the normal, the healthy persons itself. So definitely there would be a stress on the one that is with the people with disabilities, and that is why when they have stress, definitely their eating style or their habits changes, and when they do not eat, again their immunity system reduces. When their immunity system reduces, then definitely the chances of the virus spreading or infecting is very high because of the agony and the stress. And that nobody is unable to understand it, and that nobody is unable to understand what is happening all around them, and they are also unable to understand that what is happening, I mean happening in the society or happening in the vicinity where they are staying, because nobody is ready to go ahead with passing the information because of the social distancing, because of the physical distancing. And that is a unique challenge, that is a unique challenge because they do not know what's happening, because they are either unable to listen, unable to talk, unable to see. At least basically, okay, walking, I mean they are unable to walk, unable to eat, that is a different issue, but at least information sake they are unable to get what is happening. They are unable to get the latest information, and that is a cause of worry, and that will cause a very big stress on the people with the disabilities. Special medicine required for disabled people also suffer due to lockdown. Yes, yes. And people with visual impairment and blindness, and the one who are in regards to the visual impairment or blindness, if you look at, they are totally dependent upon touch for most of the daily activity. That means the one who is blind or who is unable to, what you say, listen, they are totally dependent on the touch, because the one who is unable to listen, we will tap them and say, this is what I am saying, please listen, or this is what you have to do. So we will tell them by body language, fine. And then the one who is blind, definitely the blind person, when he or she is wanting to have that locomotive or wanting to move from one place to another place within the room itself, in the house itself, definitely there is they have to compulsorily touch the or take the help of the other person or the family members or the caretaker. So definitely there is a touch which is happening, and that is a concern what the government, or else the need of the hour for the entire world in regards to social distancing is that we should not touch, we should avoid touching, we should keep washing hands. So at this time when they are, what you say, visually impaired and then blind, definitely there is a kind of, what you say, the situation which comes into existence compulsorily, mandatorily, that they have to touch. So what is that we need to do? And that is the challenge what the people with disabilities, because of the outbreak of the coronavirus, that they are bound to go ahead with taking help. And the one who, the caretaker also should maintain the social distancing, making sure that the, what you said, that touch, I mean you should not keep on touching each and every surfaces or talking about the human being now in this case, and then again keep washing. So that is again creating some kind of, what you say, social prejudice onto the person who is also taking care, even it could be the family member or the caretaker. So that is kind of, what you say, again social prejudice or social norms which are coming into the existence. And they need to hold the hand, touch, when we are talking about the hold hand, because they need to be escorted to the place wherever they want to go, and they cannot read the messages because once they are blind they cannot read the messages. So they have to listen, the one who is actually reading the newspaper, and then they would get the information of what is happening in and around the world in regards to the COVID-19 in regards to the infection or in regards to the death cases. And this, if we are trying to put them or pass on the information to them, actual fact, I mean the actual one, so definitely again they would be under stress because they are impaired, they are persons with disabilities. We ourselves are unable to cope up the kind of stress and agony, and we are definitely trying to improve our immunity system. So look at the way definitely they will have comparatively a less immunity system, and the stress would be very high, and that is the cause of concern. That is a unique challenge wherein the people with disabilities are experiencing and would also face at this moment because of the outbreak of COVID-19, and they cannot practice social distancing. That is the cause of concern now. That is the cause of concern. As they are impaired, they are supposed to be, what do you say, escorted. They are supposed to be taken to various places. It could be to the washroom or to the or going ahead with sleeping in the bedroom or sitting on the sofa. So they have to be escorted, they have to be assisted, they have to be touched. So that again is causing a lot of problem, or the biggest challenge or a unique challenge to the maintaining, or cannot precisely go ahead with the social distancing until unless a innovative approaches takes place, until unless innovative approaches takes place. So I was talking about the responsibility of the individuals, or the responsible citizen of India. What we can do is we can at least provide to the persons with disabilities in the few areas or the locations or the community, that we can provide them the white cane if possible. If possible, I'm saying again, going out and then purchasing is not really, what do you say, affordable now at this time. But if there is any kind of situation wherein an organization, NGO is going ahead, or someone is going ahead, then we can try to donate the money in regards to taking that white cane, so that they can have that, rather than having the touch escorting, they can use the white cane, and then they can make sure that they are moving into different places across, at least in the room itself, in the house itself. So that is the main point. Or else what I was saying, as a responsible citizen, we can also provide this white cane so that they can be away from the touch, or else be part of the social distancing, maintaining social distancing, and then they can do their basic individuals works. So we can be part of the helping society also by going ahead with it. Harpreet says Corona outbreak actually in history of mankind shaken the sole root of mankind, which called socialism and social society. Very good, but definitely the topic is today in regards to the social society. You are absolutely right, Harpreet. Society, and again within the social society, we are very much concerned about the people with disability, and people with disability is part of social society. You are absolutely right. Chota Bhim says that has helped them, hear them. Yes, definitely we will. And then the other one is in regards to the hearing impaired, that is the one who is unable to listen properly, the one with person with disabilities, and they are not literate enough, and those who are not literate enough cannot hear the message or read it. So definitely again they are the one who feels kind of agony, feels that kind of inquisitiveness to know what is happening around the world, to know what is happening because of the COVID-19, to know what are the measures taken by the government, to know if there is any kind of drug which is in place to actually stop the spread of the infection, not the virus, spread of the infection. And then it is not the complete dose or the clinically tested drug that it will cure the SARS-CoV-2 itself, but they are dependent on the others, and this is what they are unable to know the information what is happening. That means the current or the trend what is happening is they are unable to know, and they are totally dependent on the others. And I would say a big hi to everyone. Chotabim is saying depend on sign symbol. Yes, that I'll come up Braille. It's called as a Braille. The one who has developed is a person called a Braille, who was also visually impaired, or he was unable, I mean is blind, and then he was the one who has created the Braille font, Braille, Braille font. And here if you look at the photograph, I have taken this because the one who is unable to listen, the one unable who is unable to listen is the one who has to be make sure that he is getting the information properly. So that is what is important. Here I was talking about the hearing impaired. So this person is an hearing impaired, and we have to send a message to them. I mean, he is asking something, but he is unable to listen. He's asking something, but he is unable to get that message because of the hearing impaired. And we are the one, as a responsible people at this moment, we should not be impatient enough, we should not be having that kind of, what you say, a spur in regards to the kind of angry and all this, but very, see, we should not be like this, we should not be shouting at them, We should be very polite. We should be as a responsible citizen, trying to make sure that we are not following the social prejudice, but at the same time being part of the inclusive society, and then making the impaired one or hearing impaired one understand what is actually going on because of the COVID-19. So that is why I've come up, I have taken this, what do you say, picture. I mean, this one, pictorial representation. And now we go to the next one. Definitely there is a lacuna in spread of information. Yes, depend upon the signing symbol. Yes, definitely. That is what we are going ahead. Now, all this, why I have taken this topic is because it is a topic wherein it's not that I'm trying to exaggerate myself that, oh, I've taken a very big, very, what do you say, super topic. No. Jayant is saying, oh, it's a surprise. No, 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 that is not what I'm saying. What I'm saying is, it is my responsibility as a faculty, as educator, to bring to your notice that these are the areas we need to focus. These are the areas which are supposed to be focused, because this is the one wherein we are not emphasizing. We are just emphasizing on the health and economy, but there are certain population within the entire 1.3 billion, not only India, across the world we are talking about, that they have to be protected, they have to be taken into consideration. It is a responsibility of the government, public, private, startups, corporate social responsibility, individual social responsibility, that we have to think about them, not only in regards to all this responsibility, but as a responsible, as a you all are preparing for the civil servant aspirant to crack prelims and also crack mains, and also have a thorough understanding while you are sitting in the interview, because you never know, this time interview could also be part of this question, because it is this year itself. Okay, Arpit sings a very beautiful topic, sir. Okay, thank you very much. And then I would move further now. And many depend on lip reading. Now, WAG. Okay, WAG. I don't know when you have joined WAG. I would say once again, very good morning to everyone who have joined. Arpit says social responsibility is art of everyone. Yes, but the responsibility is an art. Nobody takes it, Arpit. When it comes to responsibility, many of them do not accept it. No, no, you're absolutely right. You're absolutely right. But I'm just a sense of humor. I'm just cracking a kind of, what you say, sense of humor in the class. Never have done. First time I'm doing it. When it comes to responsibility, nobody accepts it's an art. When it comes to a responsibility of the other, or else the other person, then we will say that it is an art. You need to take that as a responsibility. That is what is happening in the society. And then in regards to the many of them depend on the lip reading, because they cannot hear, they are hearing impaired, so they concentrate on the lip reading. And now, because of the social distancing and then wearing the mask, it becomes very difficult for the person with the disabled to get the message, or to know what the other person is talking. So there are unique challenges. If you look at all this, it looks very simple, but when you try to focus on this, then we will think that, oh, this is what is happening actually, and we were unaware in the sense, not that we do not know, we were unaware because we did not focus on it. And that is what is that, whatever the mankind, or else the one who is into preparation doesn't focus, the UPSC focuses on that. And then this is one of the, what is a unique challenge for the people with disabilities. And the one who Malappa and Pinku has joined, also a very big hi to both of them. And then when we are coming in regards to the persons with disabilities, rather than person, I would say children's here now. It is persons only, but emphasizing on the kids, children's, adolescents. So children's and adolescents with conditions like cerebral palsy or Down syndrome. That means, what is this Down syndrome? It is a distinct facial appearance. It's a distinct facial appearance wherein we are all lucky enough. We need to be thankful to the supernatural power, or the God, or whatever it is, or to our parents, or to our grandparents, for their good deeds they have done. I'm just going. I mean, it's something not related, but okay. But I'm saying, because of the Down syndrome, because their facial, they have a distinct facial appearance, and their intellectual ability is not there. They are intellectually disability, and their development delays. That is what Down syndrome is. Again, this is for prelims point of view, because looking at the COVID-19 outbreak with the peoples with disability, again there could be a question on the disability, especially focusing on the Down syndrome in the science and technology for the prelims. Down syndrome is the distinct facial appearance wherein Not only that, intellectual disability and development delays. That is why I've taken this photograph. I've taken this photograph, and I feel not because I'm on air. That is, I'm taking the class. I'm saying it, but little disturbed looking at this photograph, because this person or the one who are with Down syndrome do not or will not have the same kind of life what we are all gifted. So we should be very happy. We should be happy to even serve to the people with disabilities. We should be happy to serve the people with disabilities also. That is very, very important. And it may, I mean, when we are talking about even in regards to disabilities, it will also be associated with the thyroid or heart problems also, heart diseases. So Down syndrome, it is very, I mean, sometimes we feel that this, the one who is born, why they are born and why they are actually facing all this. So that is a different, I mean, different concept itself, but we'll not get into that. But in regards to this topic, persons with disabilities and the kids, and this, why I'm saying this is when I'm talking about the children and adolescents in regards to especially the cerebral palsy and or Down syndrome, because they are definitely, they have to be feeded, they need to be assisted in feeding. They cannot eat on themselves. They cannot, what do you say, stay also. They cannot walk properly. Their intellectual ability is not to the extent wherein the normal human being or normal child has it. So that is the point what I'm trying to make you understand in regards to the people with disability, and especially in regards to the children and adolescents in regards to the Down syndrome who have been affected with Down syndrome. So they are definitely to be the I mean feeded. So definitely we have to take care. Again, when we are talking about feeding, again social distancing. So again there we have to make sure that we are following the hygiene rules and conditions. We have to follow the hygiene rules and conditions, that we are maintaining the social distancing, physical distancing, provided we are, what do you say, going ahead with having a proper hygiene system in place. And then people with mental health issues, they cannot comprehend the message I was talking about. So because they are unable to understand, they are unable to, what you say, listen and then talk also. So it is very difficult for them to pass on the message, especially in regards to what is happening what is happening across the Indian state, India, and also across the world in regards to the COVID-19. And people with disabilities have higher risk of conditions. That means the one who have with disabilities, they have risk of being diabetes or hypertension. Please do understand how I am trying to link, or how we are going to link these topics. The one who are with people with disabilities are having higher risk of being a diabetes patient or an hypertension patient. So when they are at risk to be a diabetes patient or a hypertension patient, that means again being diabetic and hypertension is a high risk factor for COVID-19 mortality rate. Please do understand the way we have linked it now totally. Why PWD, why persons with disabilities have to be taken care, because these are the one who are highly prone to be affected or to be, as what do you say, even diabetes, to gradually get into the diabetes patient, as a diabetes patient and hypertension patient. And the one who is diabetes apart from PWD also, I mean persons with disability, even normally diabetes patient and then hypertension patient is, what do you say, maximally affected of having a high risk factor for infecting the COVID-19. So normal human being with diabetes and then hypertension is prone to have the high risk factor for COVID-19 mortality. I'm talking about not infection, mortality. That means the deaths of because of the SARS-CoV-2 infection. So look at the way the persons with disabilities would be higher risk. So that is why the need of the hour is to focus on the people with disabilities and the women with disabilities. Now this is very, very important. Again, when it is in regards to the women empowerment or women discrimination, it is very important at this moment. The women who are with disabled, they have an additional issues. What is that additional issue? Definitely they are vulnerable to be exploited. They are vulnerable section. The women with disability are the vulnerable section. At this moment there is an additional issue which is attached to them, that is they are vulnerable to be exploited. In general, it is in general, and during the pandemic again most of them try to exploit the situation of the women who is with disability. So these are the unique challenges in regards to the persons with disabilities. And now we will look at the measures. Definitely, when we have the unique challenges, we need to look at the measures for the prelims and mains point of view, because you're all civil servant aspirants. You're all preparing for UPSC prelims and mains examination along with the interview. So you need to have the challenges of the PWDs, that is persons with disabilities, and also the measures what the government can take up along with the WHO. Even WHO has come up with various measures, and the government what it can take up. So India is a signatory to the Sustainable Development Goals. So I have said once in the class how many Sustainable Development Goals. If anybody can please try to type in, because one of the Sustainable Goals is that in regards to universal access to health and education, and not only health and education but also in regards to the equity, not equality, equity. There is a difference between equality and equity. There is a difference between equality and equity. So what the sustainable development goal says is, one of the sustainable development goals, that each and every country has to provide a universal access to health and education and equity. So when it is equity to, it is everyone, it is everyone. So I would say a very big hi to everyone, and I've asked the point, I've asked the question or the point, like how many sustainable development goals are there? The one who are all very active in this, please do. Yes, WAC said very good. 17 sustainable development goals, and one of it is universal access to health and education and equity, and wherein the measure what the public, the government has to go ahead is that it has to provide the universal access to health and education for the PWD people also, and the priority to the disabilities is comparing it with the rest of the population. That is, when we are talking about almost 150 million people are the persons with disabilities, or minus, I mean 1.3 billion minus 1.15 million people. So comparatively, the 15 million people have to be provided more of priority. What priority has to be given to them? That is, first and foremost, is that waiting time when they are in the hospitals, especially at the time of COVID-19. So the waiting time has to be reduced for the identified to the persons with disabilities, and then they should be, what you say, given the priority to go ahead with the medical checkup. And that not only in regards to giving the time or waiting time has to be reduced for the for the disabled people, but also the reduced contact with other asymptomatic carrier also should be taken into consideration. That means PWD people have to be far away from the, not only with symptomatic people but also from the asymptomatic people, in the sense some X person is there, that person, he or she will not actually have any kind of symptoms in regards to the infected coronavirus, but that person will be very healthy without any symptoms but infected within. Please do understand, a person without any symptoms being healthy but infected within, he is called as asymptomatic at this moment. So asymptomatic people also, the government has to make sure that the persons with disabilities are aware, they are not having a close contact with the asymptomatic people or the carriers. What is important is the one, they are the carriers of the novel coronavirus, because that is not, symptoms are not shown, but they will definitely, they are the carriers, they are the host of the SARS-CoV-2, and then they spread without without they themselves knowing that they are symptomatic or that they are the host. They, I mean, SARS-CoV-2 is using that particular human being as a reservoir, and then trying to multiply within the human cell, and then trying to going ahead with spreading the virus virulent. And then the other measure is to make sure that the caregivers of the people with disability, caregivers in the sense it could be the family member or the paid helper for the people with disabilities, should have also access to the COVID-19 testing, because these caregivers are the one who are prone to the, because it is vice versa also, it is vice versa also, because of the caregivers, the virus infection could be spread to the PWD, that is the persons with the disabilities, or else because the persons with disabilities are prone to diabetes and hypertension, and because of the diabetes and hypertension there could be high risk of the virus being infected to the PWD, that is to the persons with disabilities. So it is vice versa. So that is why the government has to go ahead with giving to ensure the caregivers that testing has to be taken up. That testing also, it should be in a priority basis. So I would say hi again to everyone who have joined. And then we must make sure that the public material has to be converted into easy read. That means converting the public material into easy read. I think Chota Bhim or Arpit was talking about this. The even the impaired one also should be able to understand or read. How to read? Again, through what do you say, making sure that they have this, whatever I put this in the photograph, this is what it is. Look at the students who are in the school, who are blind, but they are having education, and that is because of this, that is Braille fonts. You have a fonts which are like little bit spiked. Because of the feeling, they will understand that yes, this is so and so, what do you say, the letter in regards to Braille, and then thereby they can understand what it is actually representing, or what it is actually, I mean, they can read, they can get the information, they can get the message. So we have to convert, the measure is to convert the public material into easy read, and they should be having accessible to the people with intellectual disability or cognitive impairment. So this is very important, that the people, I mean, the PWD should also be having a proper font, so that they are getting the message. And the other one is, we should keep on encouraging the disabled people. We should always keep on encouraging the disabled people, that they should be getting into the mode of playing, reading, learning, or connecting them with their friends. So playing, reading, and then learning. Playing is not really, what you say, taken into consideration because of the maintaining the social distancing, but we can do all this, even playing, reading, learning, and connecting, through telephone calls, text, or social media, by whatever, what do you say, innovative methods. Now we can go ahead, the government or the individuals or the public can go ahead, making sure that they are taken into consideration, they are always being looked at, and then they are also being made sure that they are part of it. And Brinda and Rohit, Deepika, Naveen Kumar, Yav, Abita, everyone have joined now, so a very big hi to everyone. Abhijit also has joined. So we would need to make sure that they are into this playing mode, and then the physical activity or mind has to keep on making sure that they are in a happy mood, that they are not in the agony or a stress kind of mood. That is very important. And there has to be a dedicated helpline in regards to the, they be provided with the necessity medical supplies of soap, sanitizers, and tissues. This is very very important, because as they cannot go out, or because of the visual impairment, persons with disabilities, it is the responsibility of the government to have a dedicated helpline to the persons with disabilities, and then a medical team has to be provided to them, and also the supplies of soap, sanitaries, and the tissues also should be provided or supplied to them. And then general public needs, that is educated and providing support to the for people of disability. That is what I was talking about. You and me as an individual, as the responsible citizens, also should take an initiative to support the, or to help the persons with disabilities. And what is important is, I was talking of the startups. Yes, the technology savvy professionals, here everyone can come to the rescue of the PWTs at the time of COVID-19. So even the technological savvy professionals can help by giving or by making the information available in an accessible format, wherein people can go ahead, I mean, people with disabilities can go ahead with understanding the message. So here the technology savvy professionals also can come and then rescue or be part of the helpful measures that the government is, or is and will be providing to the persons with disabilities. And what is the other measure is, online teaching programs should also be taken into consideration. Online teaching programs also should be taken into consideration, and it has to be in the accessible format, what I was talking about in regards to the listening impaired, or in regards to the Braille structures. And the foremost thing is that we should all feel that we are all inclusive, part of the society. Inclusive society is the need of the hour. This is very very important for prelims and also for the mains point of view. We need to have the, sir, last slides for 1 minute. I didn't understand slide. Okay, okay, you wanted the last slide. Okay, this I was talking about online teaching program. Technological savvy professionals can also help. The general public can also help by making sure that they are also responsible citizens, providing them whatever support they can go ahead, and then there has to be a dedicated helpline also, and then we should all make sure that in whatever means we can try to talk to them, and then keep making sure that they are not in the stress mode, agony mode, and then they should also be having kind of telephonic conversation, so that they can also use the social media. So this is all in this slide, and now I'll move to the next slide. And this is very important. Inclusive society is the need of the hour, because we all should be taking the responsibility to look at, to accept the persons with disability as, what do you say, entire, as a one family, as they are also same like us. We need to feel that that is what is inclusive society. And this keyword, take it for granted, is very very important for prelims and also for the mains point of view. Inclusive society, because this could be again in the Indian society, or what do you say, social issues. Inclusive society is very very important. And we should also consider some kind of short term financial support. We were talking about all all this time in regards to supporting them physically. Now there is a need even for financial support to be made to the persons with disabilities. And the persons with disabilities are also in the jails, for whatever reasons, for the spur of movement, or because they are intellectually disabled. So there could be possibility they are into in the kind of violence kind of things, unknowingly intellectually disabled. So they are all in the prisons, they are in the jails, and there has to be, they are also in the correctional facilities. That means they are not part of prison or jail, but they are in the correctional facilities. A little lesser what is the imposition. And what is that is important is, because the government has to make sure that when they are all together, and when there is not maintaining the social distancing, there has to be kind of measures to be taken into consideration. There has to be a contingency in plan, like an rehabilitation. Yes, exactly, it's a correctional facility, is a rehabilitation facility, wherein definitely they are not totally considered as a criminal, but because of few reasons that has been taken up. So the rehabilitation facility or rehabilitation center, you can take it into consideration. So the prisons or the jail or rehabilitation center, wherever in there, the government has to make sure that they are not being infected because of being together, not maintaining the social distancing. That is also the measure from the government. And then emergency measures, that is, they are not discriminate on the basis of disability. This is very very important. This is very very important. The government has to make sure that, or forget about government, it is our responsibility that we should not discriminate, because we tend to discriminate everyone. We unknowingly we discriminate many of them, day in day out, unknowingly, because only to satisfy our ego. But in regards to peoples with disability, and especially in regards to the outbreak of the COVID-19, that is the emergency measure. Please look at this key phrase again. What is the emergency measure is? Emergency measure is that we do not discriminate on the basis of disability, and that should not never happen. And human rights protection, again, this entire what do you say, is very very important for mains point of view and prelims point of view, this paragraph. And human rights protection mechanism, human rights protection mechanism for people with disability placed in institutional setting, that is, I'm talking about the United Nations Convention. You have one, I will talk about it. Should not be reduced. That means it has to be taken into consideration as part of the emergency measure. So what is the emergency measure is that we should not discriminate on the basis of disabilities. So when we are not discriminating on the basis of disability, that means human rights protection is actually in place. We are protecting the human rights, even though they are disabled or they are normal. We are protecting the human rights. That is important. Whether it is disabled person or normal person, that is not at all very very important. And that is because it is mentioned even in the United Nations Convention. I will also look at it. And the final note what I will look at is that there has to be a special needs of people. Nobody is addressing, that means nobody is addressing the special need of people, that is the disabilities, but it is a need of the hour. Okay, yeah, I'll just look at here. Tapavan, Nikila, Deepaksh, Deepshikta, Mandal, also has what do you say wished good morning, very good morning. Nothing to worry, nothing to worry. I'll definitely take up some time on the other Deepshika. And Mubasar Ahmad also says good morning. I would also say hi to Ahmad, hi to everyone who have joined. And what is that is the one who are with people with disabilities or part of the PWDs. Nobody is addressing them. That is why it is a trending topic. Please do understand now. Because nobody is addressing the issue of PWD. That is why it is a trending topic I have taken. When nobody is actually concentrating on X or X issue, that is what is trending. That is what you need to focus. That is what you all as a civil servant aspirant has to focus. And it is my duty as an educator, as a responsible, what you say, faculty or the lecturer, I would provide you all that. And we would fail at the human race. If we are not actually trying to reach them, we will fail at the human race. And human race is very important. What does the human race teach? Human race teach us that we all should respect each other. Humanitarian rights is that what human race teaches us. And if you don't show, please do understand, if you don't show any human response in an equitable manner with an affirmative action for people with disabilities, that means we are not part of human race. Please do understand, if we are not showing any kind of human response towards the people with disabilities, that means we are not part of human race. Absolutely, we are not part of human race, because it is our responsibility. They are humans, only disabled there. Why are we discriminating them because they are disabled? That is not acceptable. And before I conclude this, because before I take up this, I will just, what do you say, take your valuable 5 minutes time extra by your what do you say, uh, I would say hi to everyone first, and by asking you. Samrud Hastak says, sir, hi sir, what is it? I am Sandeep Bhushan. Sandeep Bhushan. Malappa Pujari says, really, it's our duty. Yes, it is our duty. Kavita Parma, Jyotirmayi, Apusha, Gaurav, Vishnu, Suman, Ambika, Chakravarti, Abhijit, Dharavad, Rajesh, all everyone a very big hi. And then I'm saying, with your permission, I will now, what do you say, go ahead with one topic which would be winded up by just 3 to 5 minutes with your due permission. Now we will discuss about India and persons with disabilities. This is very, very important again for prelims point of view 2020. For prelims point of view 2020. Because again this is factual and analytical for prelims, especially prelims 2020. Which you can also, Samrad Hastak slide. The previous slide. Let me go ahead with this. Let me go ahead with this and then I'll talk about that. And this, the bill what we are talking about, persons with disabilities, is part of the, what is an act or a bill. It is an act in India, that is the Rights of Persons with Disabilities Bill 2016 was passed by the Lok Sabha, and the bill, that is the Rights of Persons with Disabilities Bill, the Rights of Persons with Disabilities Bill 2016 was passed in, was introduced in the, what do you say, it was introduced and passed in the Lok Sabha, and the bill of 2016 of Rights of Persons with Disabilities has been replaced with the already existing one, that is the Persons with Disability Act 1995. That is very important. Here I would say, just talk about what Hamad is saying. I would say the real hero are you all, because the real hero is you all, that you are listening to me, you're understanding me. The one who says is not the real hero. The one who listens and understands is the real hero. So everyone who is listening to my class are the best heroes. And this bill 2016 has replaced the existing the bill. So the earlier bill was, or the act was, the Persons with Disabilities Act 1995, and now again later on the Rights of Persons with Disabilities Bill was introduced, passed in the year 2016 in Lok Sabha and Rajya Sabha. And this bill, or this new act, now bill has been, what do you say, got the assent by the president, and then it has become an act. And this act is in line with the United Nations Convention on the Rights of Persons with Disabilities. This is very important again from the prelims and also mains point of view. Please do understand, I will take 5 minutes, but these are the crucial and very important for prelims and mains point of view. And this act is in line with, in tune with, in conjunction with United Nation Convention. I was talking about United Nation Convention. So it is in regards to conventions, in the sense rules and regulations. Conventions means rules and regulations of the universal rules and regulations. That is United Nation Conventions on what? Rights of persons with disabilities. Rights of persons with disabilities. And two, and India is a signatory to the United Nations Convention on the rights of persons with disabilities. India is the have or signed the United Nations Convention. That is the rules and regulations. On what we have signed? On the rules and regulations wherein it is talking about rights of persons with disabilities. So now link it with the outbreak of COVID-19 and with the people with disabilities, and what responsibility the government has. Not only in regards to what you say, India has had the bill, but we are also signatory to the United Nations Convention on the Rights of Peoples with Disabilities. So look at the way we are linking it. Look at the way you have the answers. Look at the way you have the entire understanding and the thorough information in regards to the peoples with disability, linking it with the COVID-19, the challenges, the measures, and how it is again related to the United Nations. So we have looked at a very comprehensive manner from a bird's view, from a macro level approach, and then we are coming to the point. And India is all, as I said, India is a signatory, and it is effect from May 2018. This is again very important for prelims point of view, and all who have joined even after 1 hour or my session, also I would say very big hi to everyone. And then India, the government of India has enacted the responsibility or the Rights of Persons with Disabilities Act. Please to understand this. Rights of Persons with Disability Bill was introduced in 2016. This one bill was introduced in 2016. Vipasha Kautan also has joined. Hi sir, she said. I would also say very what do you say? Good morning, good afternoon, and hi to you. And then the Rights of Persons with Disability Act has come into force. Act has come into force on 19th April 2017. That is almost 2 years back. The bill was introduced in 2016. Act has come into force on 19th April 2017. It could be part of the prelims. Fine. And then according to the census 2011, India has 26.8 million. We were talking about 15 millions there, but this is the new data. That is in regards to the 2001 census, it is 26.8 million people with disabilities, that is PWD, and that constitutes 2.21% of population. Just imagine if the 2000 what you say 11 census come up, 2021 census come up, then later on what will be the situation of the count. Harpreet Singh says, sir, human race basic conscience not to discriminate on any aspect but to provide everyone equal opportunity to live life with choice and dignity. Yes, that is what that is what here, the main intention of the act is also making sure that they are also being provided. I will also what is I look at those the salient features of the act also, to make sure that they are also having the equal rights, equity, more than equality. What I'm talking is equity. There is a difference between equality and equity. The government and the individuals should provide not only equality but equity. Hamad says, after topic sir, please give brief concept about cracking tips sir in the large one. Okay, fine, I'll try definitely. And the next one in regards to persons with disability, actually when we look at the salient features now here, the disability has been defined. If you look at the definition of the disability, you will be shocked. There is no proper definition, but there is a definition. It is based on what is the definition? It is based on the evolving and dynamic concept. That is what the definition is. The definition of disability is it's based on evolving on and dynamic concept. That means there is no prescribed definition for disability. It keeps on changing because of the ecology or environment or biologically what is happening in regards to medications, various effects, side effects, or it could be the viruses what we have seen, the Nipah virus, the various kind of side effects during the pregnancy. It creates new, what you say, disability. It is giving scope for various disabilities. So thereby disability is defined as evolving and dynamic, as an evolving and a dynamic concept. And it is under what? The persons with disabilities are, this act, everything is under what? Ministry of Social Justice and Empowerment. So this is again for the prelims point of view, persons with disabilities under the Ministry of Social Justice and Empowerment. And the new law will enhance the rights and entitlements of Divyangjan. This is the term or the word which was used by our Prime Minister Narendra Modi, Divyang, not Vikalang. Please do understand, everyone. And based on this also there could be a question in the prelims, because our Prime Minister Narendra Modi has used the word Divyang, not Vikalang, Divyang, or the one with persons with disabilities. And this act, the 2017 Rights of the Persons with Disability Act 2017, lays or it enhances the rights and entitlements of the Divyangjan, the entire Jan of the Divyang. And it is also giving their empowerment and true inclusion into the society. That is what I was saying, inclusive society. I was repeatedly using this term, inclusive society, because this act says that they are true inclusion of the society. They are not discriminated because of they are disabled. You should not go ahead with that. And the types of disabilities before this act was 7, and now they have increased to 21. Please to understand, this is again very important for Divyang, in the sense, Vishnu P says that Divyang Jan. Divyang in the sense, earlier, that is an Hindi word. Vikalang is also Telugu, Hindi you say. Like persons with disability. So rather than saying Vikalang, they are Divyang. They are, what do you say, a kind of, they are more powerful kind of thing. They are not a persons who are dejected or they do not have powers, but in fact they have more of, what do you say, mentally they are more strong. The Divyang gents are mentally more strong. And earlier it was 7 disabilities, now they have increased to the 21. And then the types of disabilities can be increased, and it is in the hands of the, or it has the power who has the power to add more of disabilities is the central government. And here I have listed the 21 disabilities, wherein I will not name all that, but you can just go through it later on. And you also have that speech and language disability. You have a disability in regards to the speech and language. There is also disability, speech and language. And then there is a disability in regards to specific learning disability also. Please do understand, not only speech and language, but learning, that intellectual ability, learning capacity that doesn't develop in few of the individuals, learning disability. So even that has been added for the first time, prelims point of view. And this, if it is asked in the mains also, you can put it in the mains answer. It will be very, very effective. For the first time, speech and language disability, and also specific learning disability has been added, and also acid attack victims have been also included in the persons with disability. This is very, very important for prelims factual or the salient features. Which among the following are not part of the salient features of Rights of Persons with Disability Act 2017? You got an answer here now. Please do understand. That is how we are going ahead with. And you have what the government says is, government funded educational institutions are there which recognizes, what do you say, this kind of inclusive education, and then it focuses the children with disabilities. So definitely the salient, one of the salient feature is in regards to the making sure that they are also given education. Education is also very important because it is part of the universal or inclusive education. And there would be a reservation in vacancies in the government to the persons with disabilities, which has been increased. Earlier it was 3%, it has been increased to 4%. Please do understand all these salient features. It is very, very important for prelims, very, very important for prelims 2020. And then they would be decided by a benchmark disability. That means we have a, when they are going ahead with the reservation in regards to the vacancies in the government, then it has been increased from 3 to 4%, but they would be considering based on the benchmark of disability. That means the percentage of disabilities. of the individual, and who is a guardian, or who can the bill provides grant of guardianship. Who is a guardianship? That is the district collector. And then this guardianship is between, it is a joint decision between the guardian and the person with disabilities. That means the guardian of the person with disability is who? The district collector, and the decisions, or the what you say, the decisions taken will be in the joint decision between the guardian and the person with the disabilities, the individual. And the chief commissioner of person with disabilities and the state commissioners are acting as a regulatory bodies. This is very important. Who among the following are the regulatory bodies as per the Rights of Persons with Disability Act 2017? It is the Chief Commissioner for Persons with Disability. You have a Chief Commissioner for Persons with Disability, and you also have the State Commissioners for the Persons with Disabilities, and they both are the regulatory bodies. And you also have the Grievance Redressal Agency. There is a regulatory body, there is a grievance redressal agency. That means any problems by the persons with disabilities can come up to this agency, that is grievance redressal agency, and then they can put forward their problems. And then you also have the special courts. This is again very important. Special courts have been part of the Rights of the Persons with Disability Act 2017, that they would be the special courts for the each and every districts in regards to handling cases wherein there are violation in regards to the persons with disabilities. And here when I have taken this is in regards to the skill development program taken up by the person for the persons with disabilities by the government of India, that is the Ministry of Social Justice and Empowerment. So definitely the government is going ahead with all this. So it is important that we are focused on this, which is very very important for the prelims 2020. I hope you all have understood. Before just me closing or winding up or going out with the conclusion, I would say hi to everyone, and I feel that it was very important in regards to the prelims and mains. As no, here I was talking about nobody is addressing, but you all are proud today that you are addressing the unique challenges of the persons with disabilities. So you have addressed at least by knowing, at least by getting into that what you say conceptual challenges, measures by the government, measures by the individuals, and then the acts which are exclusively for the persons with disabilities, and also under the United Nations Convention for the rights of the persons with disabilities. Fine. So all that we have seen. Now we will conclude it here. Country's development is measured. A country's development is measured by its social support and inclusive policies. So what is important is a country will develop only when it has, or it has a social support. It is not that individual support. It has to be a social support, and that has to be taking into consideration that inclusive policies. I was repeatedly saying inclusive society. That is this what is a keyword, the key phrase, which is very very important for prelims or mains in regards to the social prejudice against the persons with disabilities. And we need to set a high standards, not to succumb to the might is right. Please do understand, this is very important. It is not always the one who are with what do you say healthy, wealthy, or physically fit is the one who is might. No, always might is not the right. The might will be right only when the might helps the society. Only when the might thinks that the mightiness of individual will be only when he or she supports or helps the society, that is in regards to the inclusive society or in regards to the inclusive policies. Only then the individual will be might or right, or else not only individual, the community or the society or the state or the country should not feel that it is might. No, it will be might only when it is going ahead with social support and having inclusive policies. And it cannot go ahead with saying that it is might is right policy, and it has to make sure that abandon people with disabilities in this crisis, and whenever they go ahead with might is right policy, then that means they are abandoning the people with disabilities. So that is very important, and I feel that the entire discussion was very helpful, and then it was very knowledgeable to everyone. And before I conclude, I will definitely go ahead with saying that please do go ahead with subscribing. Please do subscribe for 24 months. And my code, what I've said is, please do subscribe with my code SBT, that is Sandeep Bhushan Thummala, SBT 1010, SBT 10. Please go ahead with subscribing. That is Sandeep Bhushan Thummala 10. And then please go ahead with subscribing for 24 months, because as you all are aware that you would be benefited by paying just for 13 months, but you would have the entire access or the subscription for the 24 months, which is very important for the civil services preparation when you are very serious about the civil services preparation. So 24 months is compulsory preparation, and thereby you are just paying for 13 months and then getting the privilege of subscribing or viewing the classes for the entire 24 months. So please do subscribe with SBT 10, that is Sandeep Bhushan Thummala 10. So I hope everyone have understood this topic, and then they have been part of my lecture special class, which was also useful for you, informative and knowledgeable. I would say hi finally, and also I would say thank you everyone. Thank you everyone, and then see you tomorrow. See you tomorrow, and tomorrow class would be at 10 o'clock. I would also update it, but I'm saying it to the everyone. Tomorrow class, rather than 11 o'clock, it would be at 10 o'clock. 1 hour, I'm preponing it at 10 o'clock rather than 11 o'clock, because all these days we had the class of the special class in regards to the editorials or the trending topic. It was at 11 o'clock, but from tomorrow it will be, from tomorrow I'm saying, from tomorrow it will be at 10 a.m. I'm just keying in here 10 a.m. from tomorrow the class would be. Please make a note of it. Thank you. Thank you very much. See you tomorrow at 10 a.m. No. It will be for certain period of time. It will be for certain period of time. Harpreet Singh, I was just about to end the video. Good, you have asked me, sir, 10 a.m. only for tomorrow. No, it would be continuing for some time. I'll let you know again when there is a change. But at least for some time, at least for a week, minimum a week, it will be for what is it, 10 o'clock itself. Okay, thank you very much. And then please do not forget to subscribe the Unacademy Plus. That is the code SBT10. That is my code. Sandeep Bhushan Thummala 10 is my code. Please do subscribe using my code SBT10. Thank you. Thank you very much. See you tomorrow at 10 a.m.